We'll start. A very warm good evening to everyone who's in the webinar. So this webinar is a part of our national webinar series with a theme of Let's Talk Climate, which will bring leading topics in the climate, in the field of climate for discussion. We'll have a curated set of webinars which have been presented by the experts and moderated by the experts in this field. And this is an initiative which is a predominantly an educational initiative as a part of our Center for Advanced Research in Brain Infections funded by ICMR. So this month, as part of Let's Talk Climate series, we have the expert, Dr. PRIYA Dutta. She's the Associate Professor at the Trivedi School of Biosciences in Ashoka University. She is a climate change and environmental health professional with over 17 years of experience. She holds a PhD in environmental public health, and she's completed her postdoctoral training in Harvard T.H. Chan School of Public Health. She has also worked for multiple organizations like Center for Chronic Disease Control and National Institute of Health and Family Welfare. We're extremely honored to have you present this webinar on heat impacts and the success of Ahmedabad Heat Action Plan in shaping the national policy. Moderating the session, we have none other than Dr. Poonima Prabhakaran. Ma'am needs actually not much of introduction. She is the director for CHART. She's also a senior scientist at the Ashoka University, working in this niche area of climate change and human health. Ma'am has got multiple high roles in the national program on climate change and health, as well as with the Ministry of Health. We're working very closely with them. Thank you, ma'am, for having you to moderate this session. So now I hand over the session to Dr. Poonima. Over to you.
Thank you, Dr. Angel, for the kind introduction. Good afternoon. Good morning, good evening. I see participants are there joining us today from many other regions as well. So welcome to the second edition of this webinar series, Let's Talk Climate. It's my distinct pleasure to be moderating this webinar where my colleague, Dr. PRIYA Dutta, will be sharing insights from her work in this space. I'll just in the interest of bringing us all on the same page, I want to say a few words as an introductory kind of context-setting piece. As we all know, the climate change is the climate crisis is a public health crisis. And as far as India is concerned, according to the Global Climate Vulnerability Index, we feature in the top 10 countries that is vulnerable to changing climatic conditions. And this spans deteriorating air quality, heat waves, changing patterns of vector-borne diseases, and a range of nutritional impacts as well. There are several other impacts, including on chronic diseases, including mental health. But for now, I think the focus of this webinar today is on the particular environmental risk determinant, heat. And as we speak, we stand on the verge of yet another heat season that's going to hit our country. Some parts of the country are already facing really high temperatures. And where I sit in Delhi, I think the temperature is set to hit 42 degrees Celsius by the time we reach the end of this week. It's my distinct pleasure to invite Dr. PRIYA Dutta to be speaking to you, and she's going to be sharing her insights, not just on the direct impacts of heat as an environmental determinant of health, but also on her experience in one of the most important policy changes that have been emanating from the city of Ahmedabad. It's touted as South Asia's first and successful template of a city-level heat action plan. And without taking away further time from this webinar, I'd like to invite Dr. PRIYA Dutta to begin her webinar. Please feel free to share questions in the chat, but we will also have our patient presents who have a moderator discussion. So, over to you.
Yeah, thank you, Dr. Poonima. Let me share my screen.
Yeah, your screen is already visible. You can proceed with your presentation.
Okay, I cannot see. Just a second. I think there's my screen. Okay, yeah, sorry. Yeah. Good afternoon, good morning, everybody. Today we are discussing on the most important issue, the direct heat impact and the success story of Ahmedabad Heat Action Plan. Basically, this, as Dr. Purnima mentioned, this is very unique case study, which is basically a remarkable journey, policy journey. You can say it's also India first city, Ahmedabad. Heat action plan became the first heat action plan in the South Asia, and I will also tell you some interconnected policy stories. So this is not just a climate story. Basically, I just want to say it's a public health emergency and ultimately a governance challenge. I'm not able to move to second slide.
You want to place your cursor on the screen and then try.
Can I stop and start sharing again? I'm not able to move to second slide. Just a second. Sorry.
Can you log off and log, maybe reshare? Yeah, reshare it.
Somehow I'm not able to see the sharing button. Acha, yeah. It's there. Yeah, now it's thank you. Sorry. So basically, my presentation is divided into three sections from climate change and heat to way forward. Minimize this. Okay, and we'll go through one by one. So please feel free to ask question, and you can ask me anytime between my presentation. Thank you. So the first section will start with discussing the climate change and health scenario. So the heat that we are discussing is not a random weather. It is totally a predictable consequences of climate change, warming of which is happening due to the greenhouse gases and so many anthropogenic activity. One, for example, is a recent war that is going on, and there are so many long this climate related activity that is going on. Because of that, the climate change is happening, and the heat that we are seeing the frequent and the extreme heat weather that we are seeing is planned, and its predictable consequence. So we'll go into it one by one. So this IPCC two graphs that you can see is I have taken from the IPCC document. The left one is showing that the earth temperature is increasing, which is a reminder of the climate change. And over the last 500 million years, you can see there is an increase in number of hot and frequent hot weathers. And the left hand side, the right hand side is, you can see the IPCC projection. There are two projections that they are talking. So if we are see that there are two scenarios. This is RCP 2.6 and RCP 8.0. So the key message that it's trying to make in this graph, that even we are looking at the most probable, most minimal scenario, there's an increase in temperature. But under the RCP 8.0, which is using the BAU, which is business as usual scenario, which is saying that the Earth climate may increase to 4 to 5 degree. So we may face more frequent extreme heat conditions. So what this mean for India? So in simple language, if I say that we are expecting more extreme heat events, and not only more extreme, but more frequent extreme heat events during summer. So talking about India heat crisis, So approximately over 6,000 heat-related deaths officially every year is being recorded, and this is a research document, and basically which is not the actual deaths, deaths or mortality or morbidity, but is happening. It is only 10 to 100. The actual number is basically 10 to 100 times more, which is being reported. So the temperature is exceeding 50 degree in Rajasthan, UP, MP, and every year more and more cities, states are adding up. So approximately 24 states are now categorized as the severely heat affected, and which is also causing economic loss and also loss in labor productivity in India. Talking about how significant is to discuss about extreme heat and heat related deaths. So you can see this in this graph. This is showing how important and powerful and serious this heat related injuries and heat related death is. So if you see the 4 and 5 position in 2010, basically in Russia, around 56,000 people died because of heat. And in Europe, in 2003, basically, 70,000 people died because of heat wave. And if you sum up these two, you will see that which is almost equivalent, or it is more than the earthquake. So basically heat kills slowly and silently. So there's no loss in home, field, there's no construction related losses happening. And this is the reason when I will discuss about the heat action plan in India in 2010, when it happened in Ahmedabad. So NDMA, as per the NDMA National Disaster Management Authority, heat was not considered as a disaster. So if we see the disaster definition, so it's written there should be some economic loss, and heat wave is, as I mentioned, is a silent killer. It kills, but slowly. So there's no visible impact, like there's no visible impact, I mean there's no property loss. So that's the reason heat was not considered initially as a disaster. So in India, where the heat episodes are becoming intense and we have a huge number of vulnerable population, so the death toll and the severity in India is much more than the developed country. So this is showing the daily attribute to heat temperature. This is the Lancet figure. This publication, 2021 publication. It's showing a 2019 scenario. So it's saying that the South Asia, Sub-Saharan Asia, and Middle East have higher number of heat burdens, and India being the epicenter of all this global heat burden. But as you can see, this data is from 2019. And if it's continue, if the warming is continue, then of course this map will intensify. So so coming to the next section is now we'll discuss about the direct heat impact and how the extreme heat actually damages the human body. So one of the most important part before going to about the some case study is to understand what is vulnerability. So vulnerability to heat is not just about the temperature. It is basically an interaction of three factors. One is exposure, which is our heat sensitivity, how susceptible our body is to a particular exposure. And the third one is adaptable capacity, so which is the resources that we have to cope with a certain kind of exposure. For example, a construction worker in Delhi or Chennai or any part of the country. He has staying in a tin roof, have minimum adaptive capacity like no AC, limited water access, no siesta during the extreme heat conditions. So of course he will be more vulnerable to heat compared to office workers like us who has access to AC cars, sitting in AC rooms, talking about heat and making policy decisions. So of course the heat impact to different grade or different class of people in a different way. So that is also a very sandy and shady part to discuss about. So this framework is basically the foundation of all kind of targeted heat action plan, which is developed globally. It's also an important part if of India, all the heat related action plan which has been developed. So what are the different vulnerability factors? So there are five. Broadly, there are five vulnerability factors. The first is socio-political factor. So socio-political factor is like governance quality, public health, infrastructure, any kind of disaster preparedness if the community is having, and community level decisions and the facility that the community is having. Second is biological factor. Biological factor includes this age, children, elderly, pregnant women, pre-existing health care conditions, any kind of genetic abnormalities. Talking about the demographic factors is gender, disabilities, urbanization. Then geophysical is how close you are to the coastal areas, basically where you live, and how big, how climatic vulnerable you are. So if, for example, if you are staying in a flood-prone areas, so you will be more vulnerable to floodings. And socio-economic factor, we all are familiar with this word, is basically capacity to prepare, to cope, to education level, what is your income. These are some examples of the socio-economic. So overall, these are the different climate vulnerability factors. So now coming to the heat definition, which is also very interesting because there is no single definition of heat wave which is used across the globe. So for example, WMO, which is World Meteorological Organization. The definition of WMO use a relative definition, like 5 or more consecutive heat days. You can declare it as an extreme heat wave. So for example, if it is more than 5 consecutive days where the daily temperature exceeds the average max by 5 degree, then you can define it as a heat wave. And if we talk about the IMD, Indian Meteorological definition, is more on adapted for Indian regional diversity. Like for plain, there is a definition for coastal area. And overall, if we also have the same definitions for severe, we use if the departure is more than 6.5 from the normal, then we can say as a heat wave. Heat has a direct and indirect health impacts. So basically, it's like a iceberg effect. So direct impacts are the clinical spectrum, like some minor illnesses like heat rashes, heat edema, heat syncope. Moderate can be heat cramp, heat exhaustions. And if it is heat stroke, is the most severe one when the body temperature is above 40 degree, and central nervous system is dysfunction. So this is a medical emergency symptom where the patient should be rushed into the hospital. Some of the indirect health effects are cardiovascular and respiratory, like extreme if somebody has a pre-existing condition, so leading to the increase in hospitalization or heart failure or asthma. So these are the some of the indirect effect which can cause because of the extreme heat. So now who are at risk? So basically, as I mentioned, the people who are having access to some of the adaptive capacity, like have AC and you have access to some of the cooling facilities, so they are at minimum risk. So the most people who are at more risk are the outdoor workers, construction workers, street vendors, agriculture workers. They have no choice but to be in the heat and have to work, or daily wages worker, they have to work outside, which also includes your like Zomato and Swiggy worker who deliver food during the peak hot time. They don't have sometimes they have two-wheeler, and so they are also exposed to extreme heat condition. And in many places the traffic police female, they are standing in the traffic junctions. So some females, they don't have access to basic facility like washrooms, so they drink less water, so they are also extremely vulnerable to heat. So based on the in short, based on the kind of work and the facilities you have, you may be more risk to extreme heat conditions. These are the some examples from my which I have clipped during my PhD time, just to give you some idea of some of the workers, and you can understand how much exposed they are to extreme heat conditions. These pictures are from the foundry workers. So during usually the molting and everything happens during the daytime when the temperature is extreme heat. And if you see the adaptive capacity, or they don't have, they are basically, most of these small scale industry are tin roof. They don't have access to basically cooling facility, they don't have access. And just for understanding, I can say iron melts at more than 1000-degree temperature. So you can see but even to be honest, when I was clicking these pictures, it was very difficult for me to stand for 5 minutes in these places. These are the some of the examples. Talking about the stone quarries, stone quarries are the open cast mining areas where there is no tree, no shade, nothing. And in many places, there is no drinking water facility. In some places, there are some drinking water sources available. But when we collect the water, those water are most of the time are contaminated with heavy metals. And there were also, we identified that there are some cases of kidney stone and other kind of diseases also. So those can be the indirect effect of because they don't have access to potable drinking water, and they work in directly, they are exposed to extreme heat. So you can say these people have in the left hand side, they have prepared shelters, like stone shelters, just to where they can sit and have their lunch. So how now the question, how we will measure the extreme heat. So these are the some examples, some instrument just for understanding. One is WBGT monitor. WBGT is wet bulb globe temperature monitor, which measures dry bulb temperature, globe temperature, humidity. And below you can see the data logger, which is basically a personal heat monitor, which is used, which can measure the dew bulb temperature, ambient temperature, and all those things. So there are a different kind of WBGT is also a kind of index. So there are different kind of index which is used across the globe. Some country they use humidex to define the extreme heat wave. In India, we only use ambient temperature to define the extreme heat because. There are so many other reasons, so I will talk about that later. But WBGT is also under the if we when we talk about occupation heat stress, WBGT is also used as a threshold, and it is also a gold standard for the occupation heat stress because it's include the variable like dry, globe temperature and humidity, and also wind speed and other factors. Now let's go to the Ahmedabad HAB journey. So this is not, I will say, I'm sometimes feel I'm blessed because I was got the opportunity to be in this in this journey since from the inception. So this is one of the most important public health intervention which happened, and we'll start discussing about the Ahmedabad Heat Action Plan journey. So this is really quite interesting. So what happened in 2010 basically, so Ahmedabad had a extreme had a heat wave. So like for example, you can imagine how you will imagine just COVID like kind of situation. Suddenly the temperature increased to above 47 and above. So this is for India. Many people will think that it is very normal because we are staying in a certain climatic zone where extreme heat is quite common. So if you go to Rajasthan and many other places in India where the temperature is usually high and above 45 degree during the heat season. But as if you remember, I showed you one graph where in Russia many people died, in Europe 70,000 people died. So in Europe usually temperature is never reached 35 degree during that time. At 35 degrees so many people died. So it depends how acclimatized that place is to that kind of temperature. So what happened in 2010 when the temperature reached 46.8 or 47 degree approximately, uh, and this is very simple line and bar diagram, which is just to make you understand that how this extreme temperature killed so many people. So when this red line, you can see which is showing the temperature, and the red bar is the all-cause mortality, and the green line below this is basically 2009 and 2011 average temperature, and the orange background is basically 2009 and 2011 daily count, like average daily count deaths. So this graph is became one of our favorite graph because to showcase the bureaucrat that heat is killing. So because this is a simple graph, like a school student can also draw this graph, and it's showing that when the temperature is to 47 degree and suddenly there is a increase in number of deaths. And when we in 2010, when the hospital, everything was very flooded with people. Even the hospitals were not aware that how to tackle the sudden surge of number of cases, because the hospitals was like a COVID, they was not prepared to tackle so a huge number of people. So in many government hospital, what the doctors and the patients and the sisters were there, they were rubbing ice on the patient. Patients were lying on the ice cubes. So this was a very pathetic condition. And it's not that in the medical field, extreme heat conditions or extreme heat related illnesses are not taught. But what happened that we are not very commonly we discuss about the climate related events and climate related health issues. So when the patient, for example, when the patient is coming with a high temperature, it's not always necessary that that patient is having any kind of viral infection or any kind of disease. So that extreme temperature may be a climate related. So the same condition and same scenario happened in 2010. So once the extreme heat condition was over and we plotted this graph, we found there is a clear indication that it's whatever has happened because of the extreme temperature. But the irony was when we go and discuss with the bureaucrats, the policymakers, they were not ready to understand that climate like exposure can kill people, like extreme temperature can kill people, because for them temperature is normal. So they told us a very fancy line, oh, this is extreme heat is quite common in India, Rajasthan and Gujarat, इसमें तो होता ही रहता है. It's like people are exposed to extreme heat. I don't think anybody dies. So we plotted and shows this to policy people, and then that became the first steps, and they acknowledge and they accepted, okay, climate is also temperature is getting warmer, and now it's a condition, now it's a time that we should talk about climate change and climate related extreme events, apart from flood and other kind of, because we know flood and other kind of climate events are very much discussed, but we don't discuss much on heat and other kind of heat related deaths and or heat related injuries. So similarly, another interesting episode or case study also at the same 2010 also happened in one of the government hospital in Ahmedabad. And we love stories, so this is very interesting story to know. In Sardaban Hospital, which is one of the biggest Ahmedabad hospital, which is in a very crowded place in Ahmedabad, and which is surrounded by many vulnerable slum society and vulnerable peoples are staying across this hospital. And interestingly, in this hospital, the maternity ward and the neonates was on the top floor, and the reason to keep them on the top floor was to save them from infections. So during 2010, when the temperature was extremely high, the doctor, during that Dr. Kakkar was the main head pediatric doctor at Sardaban Hospital, and she observed that there is some abnormalities which is happening, which is not usual, because she is working there since so many years and she has never experienced this kind of condition in her entire life. There's a sudden spike in number of NICU cases from previous 2009. There's a sudden huge spike, and temperature was high, and there is no other kind of infection. She checked any kind of other infection which is there in the city. There's nothing was there. And then she discussed this with the administrative of that same hospital, and they were not ready to acknowledge, and they're not ready to accept that heat or temperature can cause this kind of scenario. So when we went there and we measured the temperature with our instrument, we saw that the roof of the Sardaban hospital was tarred. And the reason why they kept it tar to save it from leakage, and because of the tar, the indoor temperature was quite high compared to the outdoor temperature. And later, the roof, the intervention was that day later they accepted and they changed the roof into the China mosaic. And now in Ahmedabad, not only the Sardaban hospital, all the government hospital, PHCs use the roof are a cool roof. So, considering all those discussions and all those big background work, in 2013 we were successful to launch the first heat action plan in Ahmedabad, and which became really a turning point in India. And this was the first ever heat action plan in Southeast Asia. And it's not in a rocket science that we have developed the heat action plan. There was very simple we started with quite simple four component in the heat action plan. And we started with the low hanging fruit. For example, where the minimum funding is required, where the government don't have to spend a huge amount to start any kind of policy. So, for example, we started like during the daytime, at that time in Ahmedabad, all the garden and public gardens, they used to keep it closed. So with a simple intervention, what we did, we requested that keep all the garden open so that the pedestrian, the outdoor workers can go and rest there and provide the free drinking water and CS so that they can go rest and they can cope with this temperature. So later, many religious groups also came, and they also have helped us with with this intervention. So the first intervention was public awareness and community outreach. So which include different kind of IC materials and lectures, interaction with different kind of community vulnerable group. Second intervention is building capacity and medical community, which was very important. Though medical and doctors, they are well aware of all kind of health issues, but sometimes climate is not something that they are very familiar or they are very used to. They are comfortable, or they are more used to with other kind of disease, and climate is not whatever I say not their favorite, or not their something which is they discuss every day or every time. So we started building capacity with the medical health professional. What are the different steps? What are the simple steps where you can do? SOPs were developed, and how you will identify heat-related illnesses. Those kind of protocols, those kind of documents were also developed, and we also developed SOPs for the hospital to prepare during pre-post heat wave situation. And third is, as I mentioned, that promoting adaptation measures, cooling centers, those kind of to reduce the extreme heat exposure. How different that was the intervention 3. And the fourth and the most important was the early warning system and interagency coordination. The early warning system. So basically, if I say, usually in India, IMD, Indian Meteorological Department, provides the early warning. And if you see, we talk about IMD, usually all early warning which is given by IMD is climate based. This was the first time when the temperature plus health variables were used to calculate the data from IMD, and also we collected the all-cause mortality data because it's easy to get from the Register of Birth and Death Department. So, and we plotted this, and you can see there is a simple increase in. So, based on this graph, we we decide the threshold in 3 different colors. So it was also the first time where the color code was used, and the reason to use the color code is to it's a very simple to make under vulnerable community to understand. So if we say a construction worker that tomorrow temperature is 45 degree or 46 degree, he will not never take it seriously, or because he will say, oh, tomorrow was 43 to 34 and next day is 46. Oh, it's not making any sense. But when we say that tomorrow is red day and these are the then people, oh, tomorrow is a red day, and when you give the alert on the base of color, it is very it is very easy to explain the vulnerable community. So that's also a first kind of intervention, and that had we did in Ahmedabad, and the threshold for Ahmedabad was 43, 40, 41, 43, and 45. 45 was when we gave the red alert. And let me tell you, this is only for Ahmedabad. India is very huge and different. We have different climate zone. So this Ahmedabad condition may not be applicable in Bhubaneswar or any kind of south coastal area. So we should have different threshold for different places in India. Talking about framework, HAP framework. This is another very interesting interagency emergency response plan. Somehow in India, all departments, they work in silos. For example, environmental department or the climate department, they don't talk with the health people. So we all work in silos. We don't talk with each other. So this in Ahmedabad Heat Action Plan policy, it was also the first time when different people and different departments came together and they acted together. And this figure is showing that when the temperature, when the threshold and when the alert comes, there is in municipal corporation, there is a nodal officer, and the alert usually goes to him, and then he circulate and disseminate it to all different department, and then all department takes step accordingly as developed in different SOPs. So the WhatsApp and different kind of media was used to give the alert. And first 5 years, every year after the heat season, we used to evaluate the plan, and then we used to change the plan. So it took us 5 years to develop a simple, realistic heat action plan from Ahmedabad. And as I say, this framework is 3-tier framework, is very simple and easy to understand. And this framework is also used widely in many other cities, states across India. So cooling, the cooling intervention in heat action plan program was also very interesting. It's also we called as a low hanging fruits. So it's a physical intervention, this cooling centers. So we started in Ahmedabad by distributing this what you called the jute bags when we started, because we don't have funding. So we started with jute bags because the mayor was very enthused. And the success story of Ahmedabad, the other reason was it was top down, and the mayor and the higher bureaucrats, they were very interested, and he said, let's not wait, and let's start with the jute bag. We give jute bags to the slums where the people who are staying under the tin roof. Then the next year we introduced the reflective paints. First we started with a simple lime, then we shifted to reflective paint. So what I want to say, a simple, if you want to do some kind of intervention, so you can take the baby step, and later it sometime becomes a success story. So this is the story about Ahmedabad Heat Action Plan. Talking about the key lessons that we learned from the Ahmedabad Heat Action Plan, It involved the district administrative. As I say, it's top down, though political leadership, mayor, commissioner, everybody was involved. All stakeholders, they work together, including IMD and also NGOs. They also, for example, there were NGOs who work with construction workers. They came and they volunteered and they help us for the community outreach activities. So national and local institutes, universities also help us. And apart from this, there were also many kind of challenges that we had faced. So many state, as I say, cities, they it's very difficult to link the environmental and health. It's very what I'll say that to explain them the linkage between environmental and health. So that was also a big challenge we still face. And the connection between the climate change and rising temperature, heat related, is not still well understood in many municipal administrators. Initially, it was very difficult, but still there is a gap. But I will say it's better than the previous. So another is the data, which health data is also a big problem. And in many administrative department and many municipal, there's no environmental department or no climate or environmental department which is there. So that is also a big problem. Town planning, this is a huge problem gap, I will say. In many cities, if you say they have big glass rooms and which is facing the towards the east, and you use huge AC to cool that. So there's a huge planning and civil engineering problem that we have. We sometimes don't understand our climate, and we just move toward the fancy design, or we are influenced from the west where the temperature is different, and we should understand our climatic condition, and then we should design. So what I say that more research and is required in this field. So this heat action plan, I would say, it then became a national guideline. So later in 2017-19, NDMA, National Disaster Management Authority, they published their first national heat prevention and management guideline, and they used the same template of Ahmedabad Heat Action Plan. So this a small city action plan became a national guideline. And Telangana became the first state to include the cool roof policy in 2023 to 2028, and which ECBC guidelines were also they included in their energy conservation building guideline, this Telangana government. And now in Telangana, all the government buildings which are coming up, they follow the cool roof policy guidelines. And then the Ministry of MOFCCW, they also have developed the National Action Plan on Heat-Related Illnesses in July 2021. That was really a very good document, which talks about heat-related illnesses, SOPs, and how you will identify different kind of heat-related illnesses. So basically, it's a detailed guideline which was developed by the ministry. And these are some of the key institute or organization in India which works on extreme heat conditions. And moving to way forward, so most of these stuff I have already discussed. So evidence, partnerships, then political will, which is very important. So Ahmedabad Heat Action Plan was only successful because all kind of stakeholder, they come together, and the private sector, like cooling center, many private sectors also came together to help us in cooling intervention in Ahmedabad. They provide the CSR money to do the intervention in vulnerable community. Then priority recommendation for Indian heat responses. So some of the important that I want to discuss is labor protection. Like we should have in India. Ironically, there is no threshold or guideline for them. Budget is another important national dashboard. India should have a dashboard which talks about heat and other climate illness and conditions, and we should also have dedicated national heat mission. And then takeaway, these are the few takeaway messages. That first is direct heat impact, that just we have discussed, start from clinical to operational to mental health. Then Ahmedabad Heat Action Plan, which is a city level action plan. And then the national policy, how a small city action plan became the national level framework, which is a really a remarkable steps or the policy which got many kind of award nationally and internationally. And yeah, so then is funding, and then climate justice issues. So these are the some of the key points that I think we should discuss further future. Thank you.
Thank you, Dr. Priya, for that very comprehensive presentation from the basics of understanding heat and its impacts, direct impacts, but also sharing your insights from conceptualization to actual implementation of that city action plan, the Ahmedabad Heat Action Plan. So in the interest of time, I'll dive straight into the questions. There are a few already here in the chat, and I'll just read out a couple of them at this point. So one is a question from Dr. Arpita Paul, who is asking, are there available data on valleys lost as a result of heat-related illness in India? If you want to take that first.
There are, it's like, honestly, there's a gap, health data, there's a huge gap, but there we can use some of the international, there are some portal, like I'm not able to recall, like there are some portals available where you can get some kind of data. But of course health data is a big problem, because you can't get health data of any country, specifically India. It's not available online. So some data you can get from HMS, like NFHS, or some they share some data, but like state-wise cause specific data are not online available. You may also add.
Yeah, thank you. Just to say that, I mean, Dr. There has been one publication at least which is on all using deaths from 10 cities in India, and assessing the impact of heat on mortality in these 10 cities, which was very insightful. It was a publication from our group. But additionally, the National Program for Climate Change and Health that Dr. Priya mentioned has now initiated surveillance for heat-related illness. So that data is not yet publicly available, but that should give us some insights going forward. So I hope that answers your question. Let me move to again Ivan, who's joining us, if I remember correctly, from Zanzibar, who has a couple of questions on the Ahmedabad Heat Action Plan. Dr. Priya, first one is, are there nature-based solutions for cooling in the Heat Action Plan, the Ahmedabad Heat Action Plan? For example, green spaces, trees, green roofs, and natural aeration. That's the first question. And the second is, how is heat monitored in microenvironments? Do you use drones?
Yeah, we can. So can you just repeat the first question? Sorry,
So does the Ahmedabad Heat Action Plan use nature-based solutions? Green roofs and green spaces, trees, natural aeration.
Yeah, Ahmedabad Heat Action Plan, they just started, but I would say Ahmedabad Heat Action Plan's main focus, it was not a cool roof, it was later added. But other cities, like I gave example of Telangana, they took the cool roof way forward. So their heat action plan, even they included it in the ECBC code. So the other city, if you see the guideline, like also the Rajasthan Jodhpur, they have done really good work in cool roof and cooling kind of interventions. So apart from Ahmedabad, now other cities heat action plan, they have highlighted more on the this issue or the sector. And talking about the next step, I think microclimate, we still need more research. We have limited work in this space, so more and more study and research is required in this dimension. Still, it is not totally explored, and yeah.
Okay. So thank you. Yeah, so no nature-based solutions as we know of, at least not in the Ahmedabad Heat Action Plan, but measuring heat in microenvironments, still some way to go. I mean, people do it as part of research projects, but otherwise in external spaces, I think the monitors that are put up by the state meteorological departments are the source of heat measurements. The next question, Dr. Angel, please let me know about how we are doing on time. There are a couple of more questions. Could I go through those?
Yes, we can discuss them. I think there are two questions I think we can take.
So, Archana Kumar, I think, has a question on which components of the Ahmedabad Heat Action Plan are context specific and which can be standardized for replication in other Indian cities. For example, Ahmedabad experiences predominantly dry heat, while Chennai faces high humidity and wet bulb stress.
Yeah, so Ahmedabad Heat Action Plan first is interagency and the guideline to develop the threshold. So that the way we develop the threshold, that became a standard guideline. So many cities across India, including the Orissa Heat Action Plan. So Orissa Heat Action Plan, I would say that Orissa in 1998 they have a major heat wave. They also develop some kind of heat action plan. But their heat action plan never focus on alert and threshold. So Ahmedabad Heat Action Plan became actually a national prototype, which help the city how they will use the health data and other kind of environmental variables. I understand Ahmedabad is dry, but we also helped NDMA to calculate the threshold for 106 cities across the India, and in for Odisha, we use the humidity, because Ahmedabad we did not use the humidity because the humidity during summer is less than 20%. But other cities where near the coast, you can use temperature and humidity and plus the health data to calculate the threshold. So I just mentioned in my presentation also, the threshold is not same for the across India because we fall in different climatic zones. So this is, I would say, the alert system. The threshold was very important, which can be taken, copy and use for other cities.
Thank you, Dr. Priya. Just to add a more zoomed out view, I think what is not context specific and can be replicated, I think in other cities is the classic example of this very interdepartmental coordination that was, I think, the hallmark of the Ahmedabad Heat Action Plan. Several departments came into action as soon as the alert was received. I think that is something which is most important and should be replicated across cities as a response plan. And I think second is, I mean, the whole component of sensitization and awareness building. IEC materials, all they need to do is to have it in the local language. I think that's a very, very important part of adaptation response, to sensitize all kinds of communities, not just the community, but also the health workforce and administrative, urban planners. Everyone needs to be aware. So I think building community awareness and IEC materials, these are just can be taken and replicated in any other city. I think what Dr. Priya mentioned, the development of the thresholds has to be very context specific. Yeah, so I think one more question is from Vikash Keshri. Could you describe the specific epidemiological and climatic indicators used in the Ahmedabad Heat Action Plan to trigger different levels of response? I think you talked about the early warning system and the color coding. So what were the specific indicators, epidemiological as well as climate, that you used to develop those thresholds, I think is this question, if I understood correctly.
Yeah, so when we started, to be honest, there was no much health indicators available. So we used only the all cause mortality data because it was the only indicator that was available, and it's also many international papers. It's a gold standard. You can they because in when we talk about the health data and heat related illnesses, this is very in India like case specific heat related deaths is very difficult to get. So for Ahmedabad, we only use all cause mortality, but we also had used the ambulance 108 data. So ambulance data is also in India is it's 108 GVK data, which is a private company, but their data system is really good. So we use that data like number of call data, number of unconscious. So there are many variables that data that we had used from 108, but when we replicate it across, so we only use the all cause mortality because it was more or less genuine and accurate to be used.
Yes, sorry. I see there's one question in the Q&A panel. This is from Dr. Yashna Sharma. Seems like more philosophical, but also personal. I want to understand how, in your experience, can we as individuals contribute towards ensuring a national heat action plan, strengthening public health as well as for the larger good?
Okay. Can sorry. Can you can you tell me that again? So I sorry
How
missed
do
it.
how can we as individuals contribute towards ensuring a national heat action plan and strengthening public health as well as for a larger good? So what can you do at an individual level towards the national plan? So what they're asking.
So a good citizen of India, so we all have responsibility from micro level to macro level. Like a burning waste outside also add up to climate and increase the temperature. So basic responsibility is if we take that and all together we can help the climate. We so as I say, small baby steps can also help. So you can see whatever is available, and it's also depend in which sector you are working and how you can contribute. If you are in the health sector, or for example, then you have a different kind of stuff that you can do as a health professional. As I mentioned, that a small pediatric doctor, Dr. Khyati Kaka, she was not aware that it is extreme heat or climate, but just based on the observation and her right time intervention just changed the scenario. And then the maternity ward and the neonates, then they moved to the ground floor and the roof was also changed. So based upon your profile and your area, you can do lots of things.
Yeah, I think that was a fair answer because I think it depends on what you do. I'm presuming you're a health professional. So while there is a national action plan already, but that has to be kind of distilled down to the state and district and at a health facility level. So I think as a health professional to be sensitive, aware, and contribute to the adaptive response is very important. But apart from, helping community be aware also. So I think I don't see. Is there one more question? Heat is also part of ICD-10, I believe, as T codes. In your experience, do you think it would add value to strengthen reporting there in addition to conducting excess mortality analysis?
So the problem with ICD codes are, not many, unless you're in a tertiary or a quaternary care, it's difficult to, employ the codes. So that will, in systems abroad, it's very standard from starting from primary healthcare to the quaternary care. Any patient and every patient is automatically coded with a database. So I think to get in that type of a system into India, pan India, is a challenge. For for even for simple projects to get a retrospective data, it's very, very, challenging and difficult, especially in our Indian context. So yeah, I think those are the future. If we can, digitalize the data's health data, that will be fantastic. So I think Dr. Priya, I'm speaking purely
Yeah,
from the clinical point of view. So
no,
uh,
you have answered everything very accurately and correct. I think this is the exact
mm,
definition. Yeah, thank you.
Okay, so in the interest of time, I think we're over the hour, but I think that was a very interesting interaction. And thank you, Dr. Priya, for that very insightful presentation and for sharing your experiences from the Ahmedabad Heat Action Plan. And I think I think the overarching message and takeaway for me also to share here is heat is, I think, now this is experience from 2010, and we are like almost 15 years from that year. And I think now heat has become the buzzword, and including conversations around making heat as a national disaster. And I think rightly so. I mean, India as a country is facing heat waves, not just in the standard states we talk about, Rajasthan and Gujarat and Orissa, but even in the hill stations in the Himalayas, they were not built. They don't even have fans. So I heard last year that tourists who went there were complaining, and actually there was conflict because they were feeling warm in the hill station and there were no fans. So this is just an anecdotal thing, but there is huge awareness around heat now as an environmental risk determinant, and I think we need all hands on deck to address this emerging climate hazard as a whole, not just health professionals, but all sectors. So thank you so much, and thank you, Dr. Angel, for the opportunity to be hosting this webinar as part of the Center for Advanced Research and Climate here. I'll hand over back to you.
yeah. Thank you, ma'am. Thank you, Dr. Priya. That was an excellent webinar. And thank you, Dr. Poonima ma'am, also for this excellent insight into this whole concept. And hoping to listen from you more in the coming months. Thank you very much.
Thank you. Thank you to all the
Thank you.
participants as well.
Thank
Yeah,
you.
bye-bye. Thank you. Thank you, Priya.